One third of the world's data is produced by healthcare and health data, right? It's more now, right? Yet, as an industry, you're the furthest behind putting all that data to work. Last 10 years in the United States, one of the largest healthcare industry, the GDP in the world, health tech as a investment category, I mean, you know this, health tech did well, health IT did well, healthcare services did well. But if you ask the average patient, has healthcare gotten better or worse? Most of them will tell you it's gotten worse. If you think about it, the United States is 330 million people, and we have less than 3 million physicians to take care of them. Healthcare cannot operate like the way it is done so far.
Hey everyone, this is Prashant and I'll be your host for the VC 10X podcast. And today we have Ganesh Padmanabhan with us. Ganesh is the founder and CEO of Autonomize AI. After 11 years of scaling infrastructure at Dell, Ganesh took on healthcare's biggest problem, an industry drowning in data but struggling to use it. We are talking AI agents, healthcare transformation, and why patients say healthcare has gotten worse despite all the tech innovation. So without wasting any time, let's dive straight in. This episode is sponsored by my own podcasting agency called Podcast 10X, where I help venture capitalists, asset managers, allocators, and family offices in starting their own podcast and building a strong brand. Podcast 10X is designed in a way to work well with the busy schedule of investors, where we handle every aspect of podcast production so you can focus on investing. If you're looking to build a strong investor brand, starting a podcast should be right up your priority list. It's the only form of marketing where you can showcase your strong network, in other words, access to limited partners and founders, and grow that network further. And contrary to what most people hear, it's still very early to start a podcast. There are at least 10x more newsletters and 1000x more blogs than there are podcasts in this world. You can learn more about our podcasting services at podcast10x.com. I'll make sure to add the link in the description below. Enjoy this episode. Hey, Ganesh. So good to have you on the VC10X podcast. How are you doing?
I'm doing great, Prashant. Great to be here and good to see you.
Yeah, it's a pleasure having you on. To start things off, can you walk us through your journey from spending 11 years at Dell to founding Automize AI? What made you pivot to healthcare AI?
No, thank you. Thanks for having me again, Prashant. So my background is uh, it's very vanilla, right? I grew up in, we were talking about it. I grew up in Kerala, did my engineering after I, finished my 12th standard in mechanical engineering. Never really worked a single day in mechanical engineering, but got into mechanical engineering, but really understood, I loved it because I loved machines and stuff at that time. Then I went into the traditional corporate thing. I got a software engineering job. I used to work for a company called Adaptec, then Intel, and then Dell. Weird sort of circumstances. Dell moved me from Bangalore. I was working in Bangalore to Austin, Texas, which is where I live right now. And I did a lot of stuff at Dell. It was like, I like to say Dell is where I grew up. So I grew up how to be an operator, how to actually scale a business, how do you start new businesses and stuff like that. And I was responsible for a converged infrastructure solutions business, which we grew from nothing to $1.3 billion in revenue in 5 years. So at the end of that, it was like right after the Dell EMC merger and stuff like that. I'd spent about 11 years at Dell at that time. And I was like, what's next for me? And, two things happened. One is, as an immigrant, first thing that happened for me was like I got my green card or permanent residence, which means I'm unshackled from working for somebody. I can do something on my own. Second thing was like it was also the coming of age of big data and analytics and stuff like that in 2015, 16. AI was initially surfacing up from the bottom. And then so I started a company initially, which led to joining a later stage company who hired me to it, which was focused on explainable AI. So the thesis at that time in 2015, 2016 was if most businesses are going to use AI, black box businesses will not buy black box AI. Now, little did I know what is happening today, but so started a company which was like a Jiffy Loop checklist for machine learning models. You bring your model, bring your data, did that. So I did that, did spend 2, 3 years there in that company at Cognitive Scale, ran their growth function. Best job I ever had. learn from how do you go from big company operator mindset to builder mindset and go scale from, 0 to 1 and 1 to 10 kind of stuff. And then I did another startup after that, which is focused on data because, in 2018, 2019, we noticed this most AI projects will go to die in the data graveyard because all the data is siloed, it's all in different places in enterprises. So at Molecular, we were building a platform to centralize that data for enterprises to generate value. And then COVID hit and the whole world changed, right? So I left after our Series A raise on that company. And I was like, what do I do next? And it was very evident that one of the biggest problems that humanity faced was, healthcare, like health. We learned like you can have all the wealth you want, but people in India, people in the US, people in different parts of the world were dying of COVID because everything else falls flat if you don't have the health thing figured out. So I want to do something here. So spend a year consulting, learning a lot about the industry. I'd spent a lot of time in the healthcare industry in my previous companies, but really wanted to solve something that can create a generational company that we do things differently. So we started an Autonomize with a very simple mission, right? Healthcare operations can be, you know, uh, done a lot better. I mean, I like to say a few things like one is, 1/3 of the world's data is produced by healthcare and health data, right? It's more now, right? Yet we're as an industry, you're the furthest behind putting all that data to work. Because if you ask anybody, right, last 10 years in the United States, one of the largest healthcare industry, the GDP in the world, health tech as a investment category, I mean, this, health tech did well, health IT did well, healthcare services did well. But if you ask the average patient, has healthcare gotten better or worse? Most of them will tell you it's gotten worse. That's what we're trying to solve with Autonomize AI. How do you create an infrastructure for healthcare to run better, better for patients, better for providers, and then just meaningfully just improve the quality of life for everybody on the planet?
Absolutely, that's quite a mission, and everyone knows for a fact healthcare is a massive industry, and of course, everyone is impacted by health. If, like you said, that's the core of everything. If you don't have that figured out, everything else falls flat, right? So, give us an insight into what autonomized AI does. What does it
Yeah.
look like in practice?
Yeah. So look, I mean, Autonomize AI, we started, with this broad big mission, right? Which is saying, look, if you look at healthcare, there's a lot of inefficiencies. The cost of delivering care is very high. The inefficiencies are very, as Jeff Bezos says, your margin is my opportunity. So we looked at all the inefficiencies. If we can cut that inefficiencies, that's the opportunity to go do. So what we do at Autonomize is we have built we have a library of AI agents that are focused on or capabilities that can help a healthcare enterprise run their operations more efficiently. I'll give you two or three examples. Prior authorization is a process that is it's very prevalent in the U.S. when it's a multi-payer system, and so patients have to get approval, or their providers have to get approval for expensive drugs and processes from the health insurance company. To do that, they send a request, usually over faxes or electronic submissions, to the health insurance company. They employ hundreds and thousands of nurses and doctors to review this, map it against clinical policy, make adjudication decisions and stuff. The problem with that approach is this. One, it takes 2 or 3 weeks to hear back what your decision is on a request for a drug or something, which is, crazy for a patient. Number two, it's extremely onerous for the provider who hardly is like if you think about it, the United States is 330 million people, and we have less than 3 million, physicians to take care of them, right? And so it's a very, 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 tight workforce. And instead of working at the point of care, you have all of those folks employed at health insurance doing paperwork to review and map against different things. So there's another problem that we saw. So what we do is Autonomize, like we built an AI system or an AI co-pilot for that health plan to go and automate the intake of that information, run it against multiple things. So it's truly agentic, where it actually looks at, where do I find this information, goes fetches that information from a system, adjudicates it, provides a summary, all with the human in the loop. You give it to that particular nurse who's doing the validation, so they can do it in not 40 minutes, but in 4 minutes or less, right? So that's one example. But similarly, there are hundreds of processes like this that exist across the enterprise. And what we build is a library or a marketplace of those kind of agents that can co-create and co-work with the human employees and the healthcare knowledge workers in a healthcare enterprise. So that's what we do at Autonomize.
Absolutely. Thanks for sharing that. Quite interesting. Share with us what was the initial go to market approach that you tried, and was there any sort of resistance to it? Because healthcare is sort of has its own way of doing things, and it can have
Yeah.
resistance to change and so on. So, give us an insight.
Yeah. No, it's a great question. And healthcare is a go-to-market generally is hard. And I think we can all align to that, right? I mean, like you can build the best product, you can build the best teams, but you have to figure out, the business exists because somebody's buying, right? So I'm a huge believer in a lot of experimentation. You experiment, you see what works. And there is no silver bullet in this, like what works for me and for Autonomize may not be the same that works for my competitor, right? What worked for us, how we actually approach this. Our first customer, we actually went into, we knew that we want to have a broad vision, but we want to go and, like prove it out and create and gain conviction in one narrow spot of the segment that is large enough. If that is the only thing that we do, it should be big enough to do it. So we focused on biopharma and pharmaceuticals and clinical research for them. So in clinical research, there's a process that happens wherein an average drug, when a pharma launches it, it takes about 10 to 15 years and $2 to $3 billion to launch, right? And 80% of that cost is in this process of phase 2, phase 3 clinical trials, where you're recruiting human recruits. You have to look at their medical history. You have to understand whether they're a good fit for it, whether they're going to have the right reaction. You use all the theoretical modeling that you did outside, match it to actual physical, patient data, and then you recruit them, and then you manage them through the trial. It's very painstaking. It's very risky sometimes for the patient. There's a lot of things that, there's a lot of high, hand holding that you need to do to make that happen. But it's very inefficient. It takes 10 to 15 years, and you're looking at recruiting 300 people. So what we wanted to do was we wanted to solve that problem. So my initial approach was I reached out to everybody or companies who are focused on the clinical research process. And we very clearly said, look, I have a team of engineers who can solve this problem, but can we co-create this with you? So our initial customers were actually folks who, when we go in and say, showed them the art of the possible, but we said, we don't have a product ready to go. We have to work with you. We have to co-build and co-create it. And that formed an ethos of how we went to go to market, right? And I'll tell you what happened, right? When that turned out to be a great product, we had multiple customers taking that initial product that we had. We learned very quickly what they're trying to solve is not that patient recruitment problem. What they were trying to solve was the inefficiency in that process problem, right? So then we pivoted, or we looked at it and say, instead of actually just being I give you a solution for every problem you have, I want to teach them how to fish. So we built a platform so they can build the different solutions on their own, or we can build for them and stuff like that. And for that approach, again, we had to then find the first customer who was a large health plan who go in and said, look, we build these products you can use, but we also have a platform that it's in progress. Be a design partner with us, right? We will give you preferential early access and stuff. So that kind of a product-led iterative path is what really worked for us from a go-to-market standpoint. The other thing in healthcare, like you said, healthcare is a tough market, right? There's a high bar for quality. There is a high bar for, people don't really all understand the, AI very well. So you have to educate them. So you need trusted sources that you can actually get them to. So we did early on in our life cycle, we unlocked channel partners who have the trusted relationships. We recruited a team of advisors who were respected. They were champions in their, time, and they were actually running these healthcare enterprises. And they really knew and understood the problem. And we convinced them that, look, this is the way you solve it. They became, users and champions of it, and then they became advocates. So we created a community of networks, a network of, our community of folks who are respected. And so it's not a single thing, but what we did in the go-to-market was and then the last thing we would say on the go-to-market side is we don't go in and say, I'm going to sell you a platform that's going to take 3 years to implement and get everything done, right? We will go to where the hardest problem you have today. And most health plans, it's prior authorization. Most, health providers, it's around clinical quality or, intake or something like that. And then we go in and say, look, we'll solve that problem for you. Don't worry about the platform. The fact that we can solve it in 3 months and not 18 months, like all our competitors will do, is because we have a platform. So they see the value immediately. We give them value, very quick ROI in the next first 2 to 3 months. And then right after that, they say, how are you able to do it so quickly? Well, we have the broader platform and a library of pre-built assets that we use to go do it. Oh, then they open up the door to say, let's solve problem 2, 3, 4, 5, 6. So it's a land and expand sales motion for us.
Absolutely, quite interesting. You mentioned how design partners was the initial way you approached it, and then you unlocked channel partners. So, at what point in the journey of the startup were you say did you say that okay, now we're ready for channel partners? Let's start unlocking that
Yeah, I
path.
think let me rephrase it. It's like it's less full-blown channel partners and SIs, more about resellers, right? So what we did was early on, you know, we didn't want to be like, so there's two phases of, your partnership build out, right? So one phase is the initial phase is like, you have a product, you can deliver very quickly, but you don't have access to the customers. So how do you solve for access? That's what we did first, phase one. And that what we did for that is like we actually looked and mapped out the partners who are not your biggest and the most popular on the Accentures and the folks of the world. Now we have partnerships with them too right now, but at the time we look for folks who were like didn't have the skill sets. They didn't know that they can actually do it, but the customers were asking. They were very good customer relationships, and that customers were asking them saying, "Hey, can you solve this with AI?" And they're like, "We don't know AI. Maybe we can refer somebody else to you, right?" So we identified them and incentivized them well enough. Like we shared a lot of revenue with them to go in the door and say, like, we'll prove it to you. And they were all worried about, like, hey, quality should be good because we have a reputation at stake. So we knew we had to optimize for that. And so we delivered high quality output and we gave them value. So they became fans. And then they started introducing us to other customers and stuff like that. So that's one part of it. The second phase of the channel partnership is what we are embarked on right now is like, how do you then go and really build out a distribution network more than just like friendly partners who will refer you? And that involves a multi-tiered approach, right? One is technology partners. So we are now available, like the co-pilots from Autonomize AI is on the Microsoft Azure Marketplace. So we have a co-sell partnership with Microsoft. They go in and introduce us to customers. Now they won't do the selling for you, but the customers know their sellers get paid when we sell our products, all of that stuff. The third tier of that is then another part of that. That's the technology partnerships, and there's the SI partnerships where we're actually enabling organizations like Deloitte and Accenture to build whole business unit on top of our platform, right? And eventually, but today what they're doing is, look, I have a problem that the customer is asking for. If I build my own technology team to go build them by the hour and do it, it's going to take me 18 months to get there. You guys have it ready to go. We can do the implementation services. Let's go partner. And that's with your, emphasis, your cognizance of the world. So all of these SIs, we are very partner friendly. We know that we build an infrastructure and enablement platform and they make it come to life. So there's a win-win in this process. And so that's the next tier that we're actually embarked on. We're enabling those partnership ecosystem. That requires a lot more investment, right? That requires you to build out a training function. You have to build enablement modules and you have to make your product a lot more self-service and all of that stuff, right? We also do today a lot of forward deployment engineering. So when we see the gaps that our partners cannot fill, we bring in our engineers. That's not a primary business model, but we do know that that's actually something relevant for getting the customers really, that white glove service to go to get value with AI.
Absolutely. And from what you're saying, it sounds like there is an organic demand for AI in healthcare versus from what I assume that it would be a sell at this stage uh, to bring AI into healthcare organizations. What's your take on that?
Yeah, no, you're right. I think it's a push and a pull, right? So the pull that happens because everybody is like, look, healthcare cannot operate like the way it is done so far. I mean, humans cannot operate like the way we have. The amount of information we take as a human being has far exceeded the capacity and the capability of our brains. So you need an augmentation layer, you need the AI, you need the Jarvis suit to go make that happen. Now that is 1,000 times worse in an industry like healthcare, where, like, 6 years ago, or 10, 20 years ago, the only data you needed that you could get access to make a decision on a patient's care plan was what they told you. Maybe there was no research, there was no this thing and stuff. And that's also why the quality of life, or rather the life expectancy, was much lower 100 years ago versus now, right? Now you have all this information, but then it's the same human and the same brain and the same teams and the same structure. You cannot process it all. So the organic demand happens because I think healthcare executives and the organizations are realizing that the only way they can get away out of the cycle of margin compression, being able to deliver service, being able to extend the reach of care, right? So today, access to care is a huge problem around the world. And that's because we are not producing enough MBBSs or MDs or, folks who actually are in medicine and fast enough, right? The education takes long. There's a lot of practice. So you have to augment them. So I think there's a big realization that AI is potentially a savior. Now, I'll also caution that there's also a lot of fear and apprehension on the healthcare industry because I mean the cost of mistake is way high. Your Facebook Messenger goes down for 3 days, nobody will miss it. The people will complain, bitch and moan about it a little bit, but they won't miss it. Your billing system goes down like it did for the United hack that happened a year ago. It brings livelihoods down, right? So it brings lives down. So I think there is a lot of concern of that. So even though there's a lot of demand, there's a lot of noise in the system. You hear a lot of startups coming in and saying, "Look, hey, we'll give you an agent that'll just solve everything. It'll just completely automate all the things you're doing for your nurses doing." It's a lot more nuanced than that in healthcare because an agent requires access to all the information. Half the time, the information is not in a digital form in healthcare when you're stumped with a decision on which payment policy you adapt to it, you call Sally, who's sitting on the other room. And if Sally's not available, you wait for that case, right? How do you capture that in for agents? So there's a lot of nuance in that front. And so what we have done is actually engineered a system that allows you to hand off between AI and humans. So those are the nuances, right? Wherein, when you deliver information to a human being or a nurse or an MD, you want to give them citations, results, all of that kind of stuff, so that they can make their decision with less amount of time and with more context, right? And then on the other hand, when a human is like, I have to look at these 5 different databases to find out an information and rat in and reconcile this across this thing, and I've done it 50 times, and I have the AI agent watching how I do it. Just automate that whole thing for me. I don't want to do it anymore, right? So understanding which is the right context to automate, which is the right context to augment, itself is a superpower in the way we think about it. So there's a lot of demand, but there's also a lot of noise. So right now, the market is about, like, from a go-to-market perspective, it's a combination of consultatively helping them map out what problems should you solve first. Okay, everybody tells you, oh, let's just solve X. And we go in and we map out this thing for them and saying, look, you're spending 60 FTEs doing this thing today, and then you have this other problem here that you're spending 200 FTEs, and they're all frustrated, they don't want to work on this right now. That's a bigger problem that you should solve than this one, right? And customers appreciate that because, we're not, one of the advantages that we bring in at Autonomize is because we have a broader platform, we don't go in and shove the customer, say, you shall use this, right? We give them, there's a library of capabilities, and there is a consultant. I mean, obviously, we know where the big problems are. We look at a 10K statement from from a health plan. We know your utilization is high, your quality HEDIS scores are actually low. So we'll go and focus on that because that's going to be the immediate bang for your buck. So a lot of that consultative selling, but also the fact that there is a lot of demand and pull from the market helps quite a bit.
Absolutely, quite interesting. And I was coming to the concern bit, which you mentioned in your answer. So, one is that, like you said, a lot of the data is in the physical form right now, or in the minds of specific doctors or nurses, right? So, the first layer of solving that becomes bringing that online in some way, right? And when you decide to do that, get approvals to do that, the next layer of concern becomes data privacy, because this is healthcare data, patient data. You have to handle it with care. You know, if you happen to solve that, then the problem becomes that, what if the AI that's doing all this hallucinates, right?
Yep.
The AIs that we work with today tend to hallucinate sometimes, right? So that risk becomes much bigger in the case of healthcare, like you said. So how do you tackle all these three layers of problems?
Yeah, no, I think, there's a few things, right? One is one of the most critical things in that whole spectrum is, like, even like it's not really easy to just turn a data or a context or a knowledge online. I mean, because the fact is, the reason, like, there's every organization in healthcare, for example, they have their standard operating procedures, they have their job aids for new employees. They've all done a lot of work in there. But there's still gaps in that information because those are not easy to update and keep updated and stuff. So one of the approaches we do is we have an underlying knowledge graph that actually not, it captures all the declared things that the people say, here's what is actually happening, here's what I want. the inferred characteristics of a particular workflow. For example, it's like, look, every time Sally gets these three inputs, it's never there in the job aid, but she always does this fourth thing, right? And we have ratified it across 5,000 transactions. It's exactly what's happening. Well, that's an inferred characteristic. That's a probabilistic connection. And then there's observed, right? What does Sally say she does versus what she does, right? There's a delta in that. So you're capturing all of that. So that becomes like a, you're creating a knowledge graph or a knowledge system for the enterprise that beyond Autonomize, if the companies stop working with Autonomize, they still are left with that particular knowledge. We would capture it for them and they can use it for their own. Now that's one side. On top of this, I think what we do is like, across our stack, we thought through this, we call it our pyramid of trust, right? And the pyramid of trust starts in three tiers, right? There is a tier of, we call it guard, gauge, and govern, right? And the idea is like, so there's a guard layer, which is basically all your things, your basics. You want to make sure that you're maintaining provenance of where the data came from, what kind of data it is, who has access to it, the usual encryption, your SHA 256, your AECS, all of that stuff, right? So we're HIPAA compliant, all of that. So that's your first layer. The second tier is actually understanding context. And the context here is actually saying, look, a visiting physician looking at medical records, one of the things around HIPAA is actually authorized for use kind of a framework, which is basically HIPAA prohibits you to use data for an unintended purpose that actually you can use it for, right? But how do you capture that? There's no system to do that. It's only like what people tell you, right? But what we have is, because we have a context engine, we understand the context in that the data is used. That allows us to bifurcate and say, like, this is the context necessary for utilization management. This is the context necessary for care management versus claims versus that. So that kind of brings in a distillation layer across that. The third thing is the governance, right? And the governance comes from two things. One is your classic thing, right? Your hallucinations. So we have a lot of, LLMS judge or other models that'll actually go look at the models and make sure if you're hallucinating, you're going away from the core training data set. It'll flag that, mark it for human review. There is a human in the loop for all critical clinical workflows that actually brings up, hey, I'm not able to make a decision, or there's issues here, and here's the evidence, here's the plus and minus, and they get to make that decision. And that what they do, that gets encoded back in as a reinforcement learning into the system. And then there's a governance layer on, like, how is the model performing against the trained data set? How is the model performing in terms of hallucination, the retrieval score, accuracy, F1 score, all of that kind of stuff, and also the business metrics. Because more often than not, what people don't realize is you're often not solving a technical problem in a workflow, right? And I like to, one example we hear is like, hey, is your accuracy of extraction 99.9%? And there's a lot of problems with that question, right? If you think about, if you actually measure it, extraction accuracy from forms to typing up information for humans is at best 60% accurate, at best, right? There's, and then there's also the inter-rater variability, which is like a well-trained person versus a new person, all of that kind of stuff, interpretation, eyesight, there are a lot of variables in there. But then there's also, like, when you think about 99%, you may not need 99% to get the value you're trying to do, right? You may not even need that 60%, because what you're trying to, the problem, the opportunity with AI is you don't have to solve things in absolute. All you need to do is actually, let's say you have, 50 headcount today allocated and doing, like, wasting their time doing data entry and validating against multiple databases. And even if you're able to take half of that volume and automate that, that is still a win. Now, you could be doing that with 99% accuracy versus 50% throughput rate. Doesn't matter, because you're optimizing for the business governance layer, right? So governance to me is not just the model governance, but it's also like, what does your agent do? How is it performing to goals and stuff like that? So we build an infrastructure around it. So we call this our, pyramid of trust that we actually built in, and we baked in across all our agents, all our infrastructure, and deliver that value for our health enterprises.
Absolutely, quite interesting. And you've recently raised about $28 million Series A. So many congratulations on that.
Thank you.
Do tell us your fundraising approach and what were the strategies for targeting the right investors for you?
Yeah, so we had a, I mean, we're very grateful for the A round that we put together, and we hadn't raised a lot of money before that. So we raised a 4 million seed round back in 2023, and we still had a lot more money left in the bank when we did the Series A raise. I think first off in fundraising has been around like two things. One is, timing and targeting, right? I like to simplify this. Like, and timing was perfect. The business was actually breaking out. We can see that we were added like in Q3 of last year. Outside of our early customers, we added one customer. Q4 we added two customers. Q3 we added three customers. So it's like the trajectory was solid. We were beginning to start seeing, we waited for the fundraise for Series A because we didn't need the money. And B, in healthcare, results matter, not just the traction, right? So our early customers, it took us almost 6 to 8 months to start seeing good ROI for them. And they started becoming champions. They started talking about it and stuff. And that led to, they introduced us to some of our new customers. And so that momentum was building and the timing was perfect for us to go and say, look, we can show that we've built a great business. It is right in the right trajectory. And these days, A, B, C, all these numbers don't really mean anything because, like, we're building a scale round right now, right? And it's like Series A typically is a 1 million ARR. We were like way ahead of that when we did the Series A, right? And so one is like the timing was perfect, the tailwind was in there. We also like, again, I'll you a lot of VCs listen to your thing. I don't want to just go and raise money for the sake of money. So it's not for me. It's not about like personally. It's not about like how much money you raise and how soon you raised and stuff like that. I mean, those are probably relevant for the right reasons, but for me, it was very important that we build a sustainable business. That customers are happy. We're growing the business. You're building good fundamentals, good economics of the business, unit economics and stuff like that. And that we had a good shape of the business. So the timing was right to raise money. Now, second thing was targeting. Not everybody understands healthcare, right? We had a very fortunate fundraise process, start to finish. It took us to term sheets about 4 or 5 weeks, maximum 4 or 5 weeks, which is we're very grateful. Again, part of that was actually because targeting was right. We talked to in the first meetings, I was telling VCs, this may not be a fit for you, right? Because if you don't understand a few things, when we started the business, and right now we have multiple customers and stuff, and it's like people who understand the industry, they get it. Healthcare is a concentrated market. Healthcare payers, where we had the early traction, was even a more concentrated market. So when the moment a VC says, but all your revenue, 60% is coming from these two customers, I'm like, that's by design because that tells me that they're expanding, right? They're not just starting on the initial $300,000 to $500,000 ACV, but they're now done 5, 6, 7, 8 use cases. And either you get it or you don't get it, right? So for us, it was like targeting of, getting the right healthcare focused investors was important for us. We had like 5 different term sheets and we selected, well, we were really, really happy and with who we selected as a lead. We tried to fit in a few of the others into the round too, and something didn't work out, and the size of the round and stuff too. But I think timing and targeting were the two big things in fundraising, and then I also believed in like making it efficient for the investors, so not just for you, right? I know we did a lot of things that we did very well. I didn't bring in any of not a lot of my leadership. My co-founder was involved a little bit in the process, but I shielded them because we had to continue to build a business. So we made them, record videos of overviews of their things and stuff. And once you're closer to the term sheet stage, I'll get them involved. And we basically led the process with them. I mean, there are some investors which still wanted to run. I mean, like we were, our lead did an amazing job of going really deep into the market. They did a lot of market work that they shared with us after. So we've become, even before, we were like, look, even if, they're not the ones we do, I want to figure out a way to work with them because you get to know investors, the Valtros team in the process. So we learned that. So we ran a process wherein, look, we may try to make it efficient, and everybody respected it because, most VCs will ask you, like, what's your process for doing this? And, you just have to be, look, it's very simple. I'm not going to put a deadline and a timeline and stuff, but I want you to get to conviction as soon as I can, right? Here's the results. What really helped us, honestly, was the business was strong. So when they look back at the business, I'm like, oh, you're not just selling dreams. You have a great approach. You're very differentiated. You guys have built out the business. There's actual customers when we were raising, even today, people who claim our competitors, we don't run into any of them we are at 3 of the 5 top health plans in the United States in production for multiple quarters now, and some of them for multiple years, right? Nobody can claim that today. So it was like easier sell from that perspective. So then it was about like, you have a business, there's a strong thing, the product is strong, you've done, is this the right team that I want to back? Can they scale? Can they this thing? So we understood the psyche of that, the investors, the right investor, they were thinking about it the right way. And so we were very fortunate, like Altruist led the round, Cigna Group Ventures joined us as a follow-on. Our existing investors came in with asset management and ATX Venture Partners. Tab Ventures was an investor I always wanted to have on my cap table from the seed round. So I reached back out to them saying, hey, Amit, do you guys want to come back in? They were like, yes, we're in. So we'll do our regular seed check. I'm like, come on in. So we did that. We had some high net worth, industry executives also we accommodated for the round, but it was a, good sized round. It helps us actually really deploy capital and scaling the product, scaling the forward deployment and customer success side of the house, because we learned that you have to help customers. It's not just like I can give a product and walk away and they can figure it out, right? AI is new, the workflows are new. There's all these organizations are going through a transition, moving from, because most workflows in healthcare were built about 30 years ago. Most workflows. How do you bring that to the age of AI? You have to reimagine it, rethink it, how it was an AI first looks like. And that requires a lot of hand holding. So we're investing in all of that, forward investing in all of that. So that was the process that we ran. And so we were very, very fortunate that, the timing was right. And we ran a pretty, efficient process for everybody. And we're very, very happy with the final investors that came on the cap table.
Yeah, that's pretty commendable. But a 4 to 6 week is very very soon for a round to complete, right? Usually doesn't happen. Even if an investor has conviction, they would still like to wait and watch that. Okay, I'm going to just sit and watch them for 2 to 3 months, see how it plays out, who are the other investors coming in, and then maybe I make a commitment, right? So there has to be some sort of leading them into a deadline or something for you to close that soon,
Yeah, I think it was two things, right? One is, yes, I mean we set some deadlines, but it wasn't strict. I mean, I didn't tell any investor saying, "Oh, you have to make a decision by next week," right? Once I got the first term sheet, I did tell them, guys, I have to make a decision in a week. So if you're in or out, we're very happy with the first term sheet that we got, but I think we would love to have you as part of the round two. So make your best
right?
offer, right? So we did
That
that. But
that
the two
that
things,
that was the lead, the first term sheet. You had the lead.
the lease term sheet, right? So and then we
Okay,
also didn't want to, when we were racing, like we started off racing, let's say 20 to 25 million. We didn't want to do someone leading us with the 5 to 6 million round. We said, look, you're going to put in about 15 to 20 million to read the round, because I don't want to go around chasing the rest of the money, the follow money, right? So what we did was like two things. One is, I think more importantly, during the process, we kicked off in mid to late February, and we announced we closed in May, first, second week. We term sheets done in April and closed in May, it towards the end of May, I think. And then we announced in June, right? Because we had the third 90 days to do it. So the big thing that happened was like when we started talking to investors in February and they saw the business in Feb and March in April, we had almost doubled the business during the process. So, and they could see that. They were like, look, we closed the year, we doubled the business in Q1 for literally from last year to this thing, almost doubled it. And they could see that trajectory closing. So I think one of the things was like, as investors like to come in early, right? So we were like, look, I mean, we can race now or we can kick the can down the road. And I was sure, like, if I couldn't raise, I couldn't get a lead in about 4 to 6 weeks, I was going to shut down the process and race again after we had more traction, because I didn't need the money, right? Um, that said, I think, I knew that I could deploy capital if I have, to be honest with you, right? So what really helped build conviction for a lot of investors is like, especially our lead, and they spend a lot of time with potential customers, our existing customers and stuff. And we also protected them. We made customers record video interviews so they can actually see it, but then not talk to the customer until they have closer to conviction. And all of that really helped because they saw a lot of, we got to know these investors during this thing. And I mean, Prashant, you will know who you want on your cap table when you engage with them, right? I mean, so we kind of knew. It was like, even if it's not the best offer, we want this investor to be on the cap table. And, we ended up taking not probably just the best valuation offer, right? We took the best overall offer. And then during the process, how thorough they were, how deep they were actually going, how you could really see their understanding of the business will ensure that they can actually help us grow the business. was very important for us, right? We wanted people from the industry and stuff too. So I wouldn't say we didn't set deadlines per se, but then once we got the initial term sheet, we told everybody, look, it's not fair on the term sheet we got and say we have to go back to them at least, and it's only fair that we have to go back to them within a week, right? And then that time, accelerated the timeline for everybody. But it was more like, we saw the business in January, February, and then when they saw the business in March, it was like, oh my God, what are you guys doing? So I want to get in early rather than wait for a much bigger round later this year, right? So that's the way I think that happened. But yeah, you never know.
Yeah, amazing. A great process there. And talking about deployment of the capital raise, you said you didn't need the money at that point, but you still went ahead and raised that because you know you could deploy it in a good way, right?
Yeah,
So give us an insight into how you plan to deploy that capital. What
yeah,
percentage of capital goes into what area of the business?
yeah. Sure enough. So I think, look, I mean, I would say like the way I characterize that statement is saying, look, we were not running out of cash to go race around. So that gives us the cushion to go do it. We could actually get through the rest of the year with the cash we had because we had paying customers who were like, we were very good at our financial discipline, collections, and all that stuff. But how we think about deploying this capital, so there's a sizable Series A round, and we could have done more. Would be, it's like what you raise just what you need. The three buckets of big deployment. One is definitely double down on R&D and product, and that element of what we are actually deploying on that is, I would say probably 40% is going to go towards product. 40 to 50%, I think, say is going to go towards product, and the other 50% is go to market and customer success enablement. Right, the infrastructure so do that. The big focus on the product is like we want to enable that next ecosystem of partners to go build capabilities. Our customers are beginning to build on our platform, which is amazing. So investing more in self-service, investing more in governance, investing more in trust and safety, things that we know are very critical. Like you can solve AI, you can build a model today, you can build an AI agent today. It's not that hard. But doing it in healthcare requires you to understand the regulations, the compliance, all of that stuff. So doubling down on that whole layer of governance and compliance is a big part. Even things like building an evaluation data set. Nobody has a way to evaluate whether an AI is actually working well or not. So providing that kind of harness and infrastructure for them is going to be huge. The go-to-market side, I think, is going to be two big areas, right? One is classic sales and marketing build out, like in terms of this thing. But the other big thing is like, enabling customers, consultants who actually are clinically astute, who understand clinical, economics, who are, MDs, who are, the chief medical officers building out the team that can help customers not just implement solutions, but drive the change management needed, make sure they can adopt it, understand and learn from it, and basically co-create with them how the future needs to look like for the health enterprise. So that's the big, two buckets. I would say 50, 60%, 40, I would say 50 to 60% on R&D, and the rest 40% is more commercial, go-to-market, and customer success.
Right, makes sense. Thanks for sharing that. How do you balance rapid product development with the lengthy sales cycles typical in healthcare enterprise deals?
Yeah, it's a good question, right? So you only build what the customers want, number one, right? Basic principle, right? There are things you have to build ahead. So, for example, and I think there's a couple of companies who did this well. I mean, DevRev, Dheeraj Pandey did this really well, which is like, when you often don't know because in the world of AI, the problem space itself is emerging, right? What is a problem today is going to be not that big of a problem in 2 days, right? So one thing we did was we innovated first on infrastructure. We build a platform. It's very counterintuitive, right? Which is like any use case you use will require you to do one, two, three, four, and five. And we know that, right? Build that. You put it on a roadmap, you keep executing to it. What problems you're solving, the co-pilots, the agents, that stuff, that is organically built, usually co-created with customers, right? We go in and say, look, we have a point of view, and healthcare is highly, diverse. One particular solution doesn't fit all, right? It's not one size fit all. You have to configure it even if like people having Epic, right? Epic implementations in health plans, health providers, every single implementation of Epic is different. I mean, we worked with the hospital system. Every single instance of Epic they have across the system has got different data structures, right? So you have to co-create with the customer to adapt and configure it and stuff. So you build the infrastructure, you build a library of agents that are configurable highly. And then we deploy the forward deployed engineers to work with the customers and co-create it for what they want to do, right? That's been our modus operandi. So for what we do is we have a very robust platform roadmap that actually has capabilities that's coming that affects everybody. We have customer specific roadmap for releases that are like, basically the agents that they want. We work very consultatively and build out a roadmap for the customers and then go do that. And then there's like one-off things that we see, like the prior auth for pharmacy and the prior auth for medical and DME and some of these things. Everybody needs it. So that is a lot more productized and is ready to configure so we can go live in 30 days, 45 days, right? Compared to a claims automation capability, which it's okay to go live in 90 days instead of 30 days, right? So it's a very, I would say, multi-product approach and a platform and a multi-product approach that we do it. And it's lengthy sales cycles, but the one thing that customers are not okay with is once the sales cycle gets done, you get a deal done. In most industries, the deal is done. With Yahoo, you can celebrate. In healthcare, now you got to implement it. You got to get them value. You got to go make that happen. That's when the real, magic begins. So what we've done very well is like we tell customers, I'm going to give you 3 to 5x ROI in 6 months, or at best 12 months, right? How do you do that? Well, you take, don't try to eat the elephant, break it down into chunks. And that helps with our infrastructure being very modular. So you go in and say, look, your entire prior auth process, you want to solve everything, but your biggest problem is that intake right now. I can solve it in 2 weeks. Go live there. Then I'll get the next module in that'll actually go, take over the medical summarization. Then you go to the benefit check and eligibility. So you give them a path to get to value much quicker. That's our single biggest secret sauce that we win with customers, because we don't try to shove down here's the entire, behemoth, throw away your existing system and use mine. Never works in healthcare.
Yeah, absolutely. And when you talk about ROI and proving it to customers, what are the specific metrics that you used to show that ROI to customers, as well as use that internally to track success?
Yeah. So look, for metrics for customers, our biggest driving metric is efficiency, right? So for example, that is reduced cycle time, less time spent on the same workflow, what the parts of the workflow that they would otherwise have to spend time. So we track a lot of that and we report out. So customer KPIs, there is multiple elements of this, but one big thing is efficiency. Second is throughput, right? Can I now do more because I have more efficient system to do it? Third is quality, and quality could be like, no, am I doing it net new better? Like, then it's arguable, right? Like, for example, we learned very quickly that, I mean, it's a chicken and egg problem. If you're doing adjudication and if it's an approval, you don't need a human to touch it because you're saving time because they're anyway going to approve it at the end of the day. But you also are capturing insight on like what leads to approvals versus not. So that will allow you to go shape your policies a little better. So you can go do, medical policies better. You can do that. So efficiency, cycle time, so efficiency also means cost reduction. So we manage like, how do you reduce the cost of running operations for you? Then quality, and quality comes in multiple different ways. One is like, if it's in health, stars or yeah, HEDIS or something, it improves star rating for a health plan. Whether it's clinical quality, your improved health status, your population health, metrics go up, quality goes up. So there's multiple different metrics that we actually track by agent and by copilot, and we roll it up to that particular implementation, saying, look, every customer of ours gets a dashboard that says, here's the 15 copilots that are running. Here's how they're actually performing against, like, one is your classic utilization metrics, which is how many people are using it, what is the cycle time and stuff. And then how's that improved your cycle time? Like now I can make, claims decisions in half the time that I used to do. I'm using, you know, 86,000 less touch points to do this, which translates to about $2.5 million a month of savings because you're paying about $80 an hour for someone to do it. So we map it out from a business observability standpoint, but the product actually pushes metrics inside. Internally, we have a few measures that we use. One is like, the general everybody in healthcare does it, like how many lives do we cover? So we don't want to talk about it because it's not a bragging right, but it's basically like, can you impact enough people to with what you're doing? And we're, we're very soon will be actually impacting about half of America's population with what we do, right? So that's huge. And then also from a velocity, we do a lot of things on measuring velocity, velocity of releases, how soon can we actually get value up and a big thing for us is going to be time to value for our customers is a metric we internally measure. The saying, like we said, we told them 90 days to go live. Can we go live in 45 and surprise them and give them a thing? So things like that we work on. But yeah, it's it's all of the above.
Absolutely. Thanks for sharing that. Now, to the last couple of questions before we try to wrap this up. Looking back, what was the most pivotal decision that changed Automize's trajectory? Was it a multi-agent approach, focusing on operations, or something else?
You know, it's a good question. I never thought of that because, it's never like honestly one decision. It's often like a culmination of multiple decisions, right? So the biggest consequential decision is deciding who I want to build this company with. So my co-founder, Chris, right? I mean, we are like two different people, but then come together. We're like 1 + 1 = 16, kind of a force to reckon with. And incredibly grateful for him to actually, I had to peel him out of retirement and comfortable jobs to come and do this with me. So that was a huge consequential decision that we did. Second big decision I would say is like in the, first our first few customers, right? We went with customers who we could build really deep relationships so we can understand and learn the industry. As an early stage company, one of the biggest thing that most there is a founder's regret that happens in most startups, right? Said, why did I end up doing this? Right? Or why did I choose this one? Right? Unless you have so high conviction. So there's a process that you cannot force, which is, so what happens, and I see a lot of founders who off the gate, they have good pedigree, they've done very well, they go and raise like $30 million in a seed round. And then they can figure this out. 6 months later, they're trying to squeeze the juice out of it. And it's like, I can't get myself to do anything. I don't like this. This is not what I wanted to do. And like, it's all of these things. And then it gets into the first year, one of the biggest consequential decisions we did was like, we wanted to go in, learn more. We only cared about learning. We only cared about learning the customer, learning how they think, how they operate and stuff, and building really deep relationship because that gets you, humans, all outcomes in life was driven by humans and, people and relationships. And so we focused on that. So that was a big consequential decision. Choosing who to take our seed round in our, we did a prize seed round. Asset Management Ventures was our lead, investor in that round. Skip Fleshman, getting them to actually invest and having Skip on the board was a huge decision. Skip comes in with a lot of experience on, in healthcare and company building, 30 plus years, and he's like the Yoda of company building. So really helped us navigate early decisions, early things. Hey, don't worry about it. You are worrying too much about this thing. That is not a problem. Focus on this, right? That kind of stuff, governance, all of that stuff was a great friend to help us navigate through it. I think, the last few years, I think the biggest thing we did was actually doubling down, and we knew very quickly. I think I would say the big consequential decision, one of the big ones, is actually we used life sciences as the initial entry point for us in healthcare. But when we started seeing the traction on uh, health plans and health enterprises, because what we learned was like the biggest problem in healthcare is efficiency. It's the cost of healthcare. And cost leads to the quality of care problems, cost lead to the access to care problems, everything. So that was the lever that we can unlock. And who has the largest cost in doing that? It's healthcare and, not pharma. Pharma didn't cares about cost, but they care about drug prices and stuff too. What these guys care about, like health plans and which is insurance companies and health systems are the ones who care about cost. So that was I wouldn't say a pivot, but because we did a lot of work that is palatable from pharma to here, but then just doubling down on our approach to go make that happen was a big consequential decision. I think this, Series A, I'm hoping in a year from now, I'll look back and say this was a huge decision, finding the right partners on our board, the right approach for it. Cigna Group Ventures have been great. We do a lot of work with the group and, this is great to have them also financially aligned with us and things too. So I think it's incredible. It's a startups are always like it's not one decision. It's like the microcosm of like a million decisions that you make on a daily basis. So that's the way we approach it. But great question though.
Absolutely. To the last question before we try to wrap this up. For founders targeting heavily regulated industries like healthcare, What's your playbook for building credibility and navigating compliance from day one?
You know, that's a good question. Well, compliance is one thing. Compliance you can navigate. It's not as hard as people make it to be. It's just stricter. You just can't be loose. You gotta have, I gotta have a, I can't just have a open door. I have to have a badge at the door. I mean, things like that, which you can figure it out. That's easy. I think the harder part is like getting into a regulated industry. It's a, you know, I like to say something to my teams all the time, and it's very true. It's actually from the Bhagavad Gita, right? Which is like give up the fruits of the action. Um, so I like to say like impatience for action and patience for results. That's what I tell everybody, right? Healthcare or any regulated industry, that's what you need to do. You have to have the impatience because otherwise you're not going to make any changes. You have to be, urgent. You have to treat this problems are like we got to solve it right now and stuff like that. But then you have to have the patience for the results to come up. It's going to take a longer time, longer sales cycles. It's a lot of mind shift changes. People have done operations in a certain way. So that's one big thing. So as a founder starting there, usually like you should think about it as like, read the Bhagavad Gita. It'll help you actually reframe, karma yoga will give you a framework to think through it, right? So that's one. Impatience for action, patience for results. The other big thing I would say is like, look, every industry warrants change and no other industry than a regulated industry needs more change, right? So find the champions, go find the folks who want to change and then listen deeply to them. Just embed yourself, understand it, and because you'll learn a lot. Because what Chat GPT tells you or what you can do on a Google AI mode search or otherwise is not what this industry is all about. There are so many contradictions here. I mean, podcasts are great, blogs are great, people talking about this is great and stuff, but you cannot replace the one-on-one individual conversations with people to understand how they operate, what they struggle with, what they leave, what they're really excited about and not excited about trumps everything else. So listen deeply, find the change makers who want to change, even find the detractors and listen deeply to them too, right? So I think those two things I would say are like some good thing. And then regulation is regulation, which just means you're paying more for lawyers, you're paying more for, so you got to budget that in, and then you find the right people to do that for you. So that's the way I would see it.
Absolutely. Yeah, that's one beautiful learning from Bhagavad Gita and one of the main ones. If you want to take one from the entire book, there are many, of course. But thanks so much for doing this with us, Ganesh. It's been an incredible conversation, a lot of insights for me as well that I can apply to my businesses as well, and I'm sure for our listeners as well. Thanks so much for doing this. Do let our listeners know where they can learn more about what you are doing at Autonomize AI and where they can follow you.
Yeah, no, thank you. Thank you, Prashant. So yeah, you can, reach out to us, follow us on LinkedIn, Autonomize AI or Autonomize.ai. I mentioned to you, I also I run a podcast called Stories in AI. We can, if you want to follow that, it's on Spotify and all the platforms. What I've done there is actually try to get folks who are deep in the industry, not just healthcare, but other industry, in getting their perspective on how they think about applying AI to their lives. And that could be CDOs and CIOs thinking about how do you deploy, how do you manage it, or business users who are like, I'm struggling with this and I'm going to do this thing. So, and I do believe that AI is such a critical piece of humanity's history as we go look back from 100 years from now, that you want everybody to take part in the build process of it, then just be affected by it, right? So thanks so much for having me, and it was such a pleasure, and thanks for the great questions.
Absolutely. Wish you all the best. Thank you.